Good morning to you.
I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Smith, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. And before we get started with a very robust calendar, do any of the members have any personal orders? Okay, seeing none, we will start off. Chairman Halsey, we have to give people the posture of the bill. Currently, the bill has two amendments on it. We placed one amendment on there, and then we placed another amendment that rewrote that. So in speaking with legal, what they would like, as opposed to when we go on the floor and we put an amendment on the floor that strips everything off, they would like us, if we're doing anything with this bill, to take that first one off of the bill. So and that would be amendment, is it 3720? 3720. And so with that, I would like to recognize Chairman Ramsey.
And thank you, Mr. Chairman. And I had made the motion to place 3720 on the bill. We had subsequently offered 4462 and had not adequately reconsidered our action to take 3720, which are essentially the same amendments. And so the committee adopted the first amendment to rewrite the bill in Health Sub. Then it adopted it again in full committee. After the adoption in full, we discussed, and the second amendment was drafted and presented, which essentially is the same. The full committee prefers the second amendment over the first, as apparently does the sponsor. In an effort to send the bill out full, the committee in a clean posture, we need to reconsider our actions on amendment 3720 and withdraw that amendment. With that explanation and understanding that the sponsor has actually made a plan to roll the bill, but has agreed to allow us to take care of this issue in preparation for further consideration of it, I would make a motion to reconsider our actions on amendment 3720.
Okay. Got so moved. Okay, we have a motion to withdraw amendment 003720. So without objection, amendment 3720 is withdrawn. Okay, we are back on the bill with one amendment on it, and Chairman Halsey, you're recognized.
Thank you, Mr. Chairman, and thank you for your indulgence. I was going to request to roll this to the last calendar to see what kind of progress it makes in the Senate side. There's no point in us going through this if it doesn't gain some ground over there, if that's all right with the committee.
All right.
I'll make that motion.
Okay, we have a motion. You have a second to roll to last calendar. Any objection? Seeing none, we are rolling House Bill 13 to last calendar of health. Thank you.
Thank you very much.
All right, that brings us to item number 2, House Bill 179. Representative Hall, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman,
You have a motion and a second.
may I present my bill from my seat?
Absolutely.
Thank you, sir. House Bill 179, as is currently written, healthcare centers and providers and facilities are given liability protection under the Patient Safety Quality Improvement Act. And House Bill 179 just adds federally qualified health centers to that list.
Okay. We have a proper motion, proper second. Any questions on the bill? Seeing none. Okay, we will be voting on House Bill 179. All those in favor say aye. Opposed? Okay, ayes have it. The bill goes on to calendar and rules.
Thank you, Mr. Chairman.
And that brings us to item number 3, House Joint Resolution 85. Chairman Kumar, you are recognized. Do you have a motion and a second?
Thank you, Mr. Chairman. This resolution acknowledges the fact that cannabis is a naturally occurring plant and has in its use form certain psychoactive effects that can be harmful, but some medical effects that can be useful. The FDA has approved the synthetic forms of cannabis or marijuana for 4 conditions that it is found to be of medical benefit. Those conditions include nausea and vomiting for chemotherapy, muscle wasting in AIDS, neuropathic pain, and muscle spasms. On the other hand, while FDA has found it to be useful in those 4 conditions, the DEA still, which is part of the Department of Justice, the Drug Enforcement Agency, still classifies marijuana as a Schedule I drug, which means that this is a drug that has a high potential for abuse and no medical benefit. These 2 positions are not consistent, and they are occurring in the agencies of the one United States government. This resolution asks the DEA to reclassify marijuana from Schedule I to lower schedules, so 1, it is available for research and can be properly studied. I'll be happy to answer any questions.
All right. We have an amendment on this, and the amendment is 004079. And that is, I'm carrying that amendment, and for us to put that on there, I'm going to have to pass the gavel to Vice Chair Leatherwood.
Chairman Terry, you're recognized on Amendment 4079.
Okay. Thank you. This amendment is a friendly amendment, and it was the bill. We actually passed this bill through Health last year with this amendment on it, and I think the original draft had we were going to encourage the DA to reschedule marijuana to a Schedule II. And this just says we're going to encourage the DEA to reschedule marijuana because some of the medications that are out there are Schedule III, Schedule II, Schedule VI. Some are off schedule. So it just makes clarification that we're want to have them to just reschedule. And this is the same that we passed last year.
Any questions on the amendment? Seeing none, any objection to the question on the amendment? All right, we'll be voting on Amendment 4079. All those in favor say aye. Any opposed, say nay. The ayes have it. Amendment 4079 goes on the bill.
All right, thank you. We are back on House Joint Resolution 85. Chairman Kumar, you recognize. If not, any questions on the resolution? Okay, questions been called? Okay, without objection, we are voting on House Joint Resolution 85. All those in favor say aye.
Aye.
Opposed? Ayes have it. It goes, House Joint Resolution 85 goes on to calendar and rules. So for the committee, I actually have a bill to present in another committee. I am presenting item number 8, House Bill 142. So before I leave, without objection, I'm going to roll that to the Hill with the intent for me to bring it back up into its place when I get back. So without objection, 142 to the Hill. And I will pass the gavel on to Vice Chair Leatherwood.
Just a question. 146, it says as well.
Chairman Terry, you were supposed to present for Thomas Smith. We rolled that to the Hill. I think
Smith.
Alexander's.
Okay. Okay, this brings us to House Bill 552. Chairman Whitson. You are recognized.
Mr. Chairman, request to present it from here.
Absolutely.
Thank you, sir. Thank you, committee and chairman. This bill seeks to clean up the scope of practice statute. Oh, excuse me, we need to put the amendment on that makes the bill.
Okay, there is an amendment. Got a motion and a second, and just to confirm, this is Amendment 4368.
Yes, Chairman, that is correct. And that makes the, rewrites the bill, sir.
Okay, you are recognized on the amendment.
Okay.
There was a motion and second.
Okay, and yes, again, that rewrites the bill, so.
Okay, we'll be voting on Amendment 4368. Any questions on the amendment? Seeing none, any objection to the question? All right, we will be voting on Amendment 4368. All those in favor say aye. All those opposed say nay. Ayes have it. The amendment goes on. You are recognized on the bill as amended.
Okay, thank you, Mr. Chairman. This bill seeks to clean up the scope of practice statute by including a definition for store and forward telemedicine services in Title 63. This bill will not change the definition for store and forward in Title 56, and as such will not change reimbursement standards. This bill simply removes the definition referenced in Title 63 and restates the definition of store and forward telemedicine in Title 63 without the image requirement. With that, Mr. Chairman, I renew my motion.
Okay, do we have any questions of the sponsor on House Bill 552? Question's been called. If there's no objection, we will be voting on House Bill 552. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it, and your bill passes. It moves on to calendar and rules.
Thank you, Mr. Chairman. Thank you, committee.
This does have an amendment that does not make the bill.
Okay. And you say Alexander?
Rebecca Alexander.
Okay, this brings us to House Bill 146, and as I understand, Representative Alexander is going to be presenting this bill, and we do have an amendment on the bill. Just to confirm, is that Amendment 3638?
It is, sir.
Okay, we have a motion and a second on the amendment. You're recognized on the amendment.
Thank you, Chairman. I am presenting this bill for Representative Robin Smith, who's had to be at a funeral. In 2019, it became known that Tennessee had over $725 million in reserves that had been drawn down from the federal government for the purpose of assisting needy families in our state. That's our TANF funds. A working group was created with the charge to examine this large accumulation of funds. House Bill 146 will direct the Department of Human Services to report on a quarterly basis the availability of the federal funds that are distributed by the department for the purpose of adult and family services, child support, and rehabilitation services. The specific information reported must include the amount and the source of the funds, the amount of federal funds budgeted to be spent in a current fiscal year, the amount of federal funds set aside as the department reserve both cumulatively and in the current fiscal year, any restrictions or requirements on the funds available for appropriation, and whether unspent funds carry over to the next fiscal year.
Thank you. Do we have any questions of the sponsor? Leader Gant, you're recognized.
Thank you, Chairman. The amendment only added the language that those reports go to the health committees, the Senate and the House.
Okay, thank you.
Sorry.
No,
Did it
thank you
backwards.
for that addition. Leader Gang, you're recognized.
Thank you, Mr. Chairman. Just wanted to verify that this is not technically your bill, right?
No,
So have you presented a bill in this committee before?
no, I have not.
Okay, so I just want to make sure we make
But I
part of the
don't think
record
it's,
that this is not technically her first bill in this committee. So we reserve the right to get you when you actually present a bill in here. So just want to make that part of the record. Thank you, Mr. Chairman.
You're welcome. Any other questions? Okay. Okay, questions have been called on the amendment without objection. We will be voting on Amendment 3638. All those in favor say aye.
Aye.
All those opposed, nay. Ayes have it, and the amendment goes on the bill. Representative Alexander, you are recognized on the bill as amended.
Well, since I did it backwards, sir, I think that we're okay.
Okay. Question has been called on the bill without objection. We will be voting on House Bill 146. All those in favor say aye. Any opposed? The ayes have it. Your bill passes and moves on to calendar and rules.
Thank you, Chairman. Thank you, committee.
Okay. And this brings us to item number 6, House Bill 734. And as I understand, Representative Dr. Kumar will be presenting this bill.
Thank you, Mr. Chairman. Yes, as you heard, Chairman Smith had to be out, and it's my honor to present this bill. House Bill 734 deals with the fact that as a response to the COVID-19 public health emergency, the CMS enacted a number of waivers to provide flexibility in meeting the workforce needs in various hospital and related facilities. It allowed the facility to use temporary nurse aides, TNA, by waiving the provisions of further federal regulations required. And pursuant to Executive Orders 14 and 15, the Tennessee Department of Health also allowed this, and the creation of and use of TNAs because facilities were gravely concerned and in need of staffing. Considering that as we near the end of this public health emergency, it is important that those nursing aides who have had the training by now and had the experience, they can continue to function in their current capacity. This legislation will ensure that TNS can continue to work and an immediate loss of these workers at the end of the public health emergency does not occur. There are approximately 1,229 of these good people, and as the bill says, they should be allowed to continue. Thank you. With that, I'll be happy to answer any questions.
Okay, do we have any questions of the sponsor? Seeing none, any objection to the question? Okay, we will be voting on House Bill 734. All those in favor say aye.
Aye.
All those opposed say nay. Ayes have it. This bill will be moving on to government operations. Item number 7, House Bill 548. I do not see Representative Chairman Jernigan here, so we will move that to the Hill. And so 8, did he move that to the Hill?
Yeah, so we're on 705 right now, item 9.
Okay. And just to reiterate, item 8 rolled to the Hill as well. So brings us to item 9. Is Russell?
No.
By Representative Russell. Oh, there he is. Okay. We have a motion and a second. House Bill 705. Representative Russell, you are recognized.
Thank you, Mr. Chairman and committee. House Bill 705 adds vaping to the Non-Smoker Protection Act. As a result, vaping will now be prohibited in the same places that smoking is prohibited and treats vaping in the same as tobacco in the preemption section of the code. In other words, the state will regulate the vaping policy with respect to where vaping is allowed to have uniformity across the state.
Okay, thank you. Okay. Representative Freeman, you are recognized.
Thank you, Chairman. Thank you for bringing this bill. You may remember my objections last time. and I'm just going to share it again with the full committee. I appreciate this being added to the Smoker Protection Act, but it does away with some local control. And one of the things that the local control does is limits flavors of some of the vaping that has been proven to be targeted at youth. The other day in health presentation, Dr. Piercy shared two stats that were pretty disturbing to me. One is, while we have 10 people a day die from opioids, we have 30 people a day die from tobacco use. We had 25% of high school students in the last 30 days admit to vaping. We should be doing everything we can to limit the access of vaping to the youth. I know it's 21 and up, but they're getting it, and they're targeting some of these flavors and high nicotine counts to get these children hooked. And so while I fully commend you for restricting it in public places, taking that local control away is a problem for me. And I hope the state takes notice and puts some of those restrictions in place statewide.
Representative Russell, would you like to respond?
Thank you, Chairman. I just want to say that if it's a problem locally, we probably need to look at making it statewide, because if it's a problem where we, in our cities, we need to make sure we correct it statewide rather than just a local town.
Chairman Williams, you're recognized.
Question on the bill.
Question's been called. Any objection to the question? Seeing none, we will be voting on House Bill 705. All those in favor say aye. All those opposed, nay. All right, the ayes have it. This bill will be passed. Moving on to calendar and rules. Thank you.
Thank you all.
All right, thank you for the indulgence of the committee to let me go present a bill. Without objection, we're going to pull up House Bill 142 from the hill of the calendar. I will be carrying that for Leader Lamberth, so I will give the gavel back to Vice Chair Leatherwood.
There you go. All right. Okay, I have a motion and a second on House Bill 142.
Right.
Chairman Terry, you are recognized.
Thank you. And there is an amendment number 4527.
Do I have a motion and a second on the amendment? Okay, and for my, what was that number again?
4527. It's down here.
Oh, okay.
So all of this is the explanation for it. And that's the bill.
Oh, okay. So 4527. All right,
Right.
Mr. Chairman, you are recognized on Amendment 4527.
All right, thank you. This amendment, this is the Tanf Opportunity Act. That is a collaborative piece of legislation between the administration, DHS, Commissioner Carter, and the Tanf Working Group put forth by Lieutenant Governor McNally and Speaker Sexton. And while I chaired the working group, I really want to give recognition to the members of the working group. Senator Watson, Dickerson, Akbari, and Senator Hale had input as well, and thank the efforts of Representative Smith, Hawk, and Love. As you're likely aware, DHS receives yearly recoupment grant of $191 million to go towards TANF, and the state of Tennessee has amassed a reserve of over $700 million. DHS may utilize those funds with four main purposes in mind. One is to provide assistance to needy families so that children can be cared for in their own homes. Number two is reduce dependency by promoting job preparation, work, and marriage. Number three is prevent and reduce the incidence of out-of-wedlock pregnancies. And number four is to encourage formation and maintenance of two-parent families. DHS utilizes the TANF funds in those four main categories to achieve those four purposes. Those categories are cash assistance, a reserve, workforce development, and community grants. The bill addresses each of those categories while enhancing protections against fraud and abuse of the TANF program. So what the bill does, number one, the program integrity protections. It increases penalties for TANF and SNAP fraud while ensuring the confidentiality of personal information of individuals who report fraud. Number two, there's incentivizing self-sufficiency for families. It does that by increasing the cash assistance. There is a Pathway to Prosperity pilot program which incentivizes recipients to improve their workforce skills via education, trade school, or apprenticeships. Number three, we have TANF Reserve Investments, which has a TANF advisory board to evaluate the efficacy of the program. There's a Tennessee Opportunity Pilot Program, which will help Tennessee develop proven and effective community wraparound services for recipients. And there's the Family First Community Grant Program. And fourth, the unspent annual award, it keeps a reserve at a level to ensure funds are either getting to recipients or via wraparound services in the communities, but ensures that Tennessee has funds in case of a downturn. And with that, I'll happy to take questions, or we have DHS here that can answer questions.
Do we have any questions as sponsor? Representative Hakeem?
Thank you, Mr. Chairman. I would just ask Chairman Terry if you'd make it clear on that 700 million as to whether part of those funds are already obligated. Wouldn't want anyone to leave here believing we had $700 million not obligated in some way.
Chairman Terry, you recognize?
Thank you. Great question. Currently, the numbers that I have is we have 205 million that is obligated towards 2-gen contracts. We have 82.7 million that is dedicated to the education summer camps, and then they have 191 towards the rainy day fund. So it leaves a balance of around 230 million in unobligated balance. With that in the bill, we have 50 million going towards the Family First community grants, and the other 180 plus going towards the Tennessee Opportunity Pilot Program.
Thank you, Mr. Chairman.
Okay, Representative Clemens?
Thank you, Mr. Chairman, and thank you for this legislation, Chairman Terry. I have a few questions. This, I know the bipartisan working group that you referenced by name. Was this the final version of the unanimous adoption or action of that committee?
I'm not sure I understand. This is what we have worked on with oh, excuse me, I just need to be recognized.
Chairman Terry, you are recognized.
Thank you. This has been worked on with that working group as well as with Commissioner Carter and with DHS.
Yeah, so my question is, did the working group unanimously adopt this as the legislation they wanted to come out of that?
Chairman Terry, you're recognized.
To my knowledge, none of the members of the working group have opposed this legislation. We have not had a further meeting of that working group this session to formally adopt that.
Representative Clemens?
Thank you. And then one of my other concerns is there's this advisory committee creating another level of bureaucracy composed of no more than 21 individuals. Can you speak to why that substantially sized type of advisory board is necessary, or why we need to add that level of bureaucracy? I'm concerned that that's going to further slow up spending these badly needed funds. Can you just address that?
Chairman Terry, you're recognized.
Thank you. Great question. One of the issues, and DHS may be able to answer that question a little bit if they need to, but one of the issues that we have with some of these applicants for these wraparound services and for these 2-gen grants or these community grants, they have difficulty in making their applications and going through those applications. So this actually could help speed those up. Additionally, what this group will do as far as research and making sure that these are effective and well thought out grants. It will help DHS identify these programs so that we can get these into the communities that need them.
Representative Clemens.
Thank you. I appreciate that response and your thoughtful work on this and everybody's work on this. What our state has done and the way we've neglected this and allowed these funds to pile up is one of the most embarrassing, harmful things that has happened or that the state has done during my short tenure up here in the legislature. So I'm glad to finally see us working to resolve that and get these funds spent where they're intended. So thank you, Mr. Chairman.
Thank you.
Representative Hakeem.
Thank you, Mr. Chairman. Chairman Terry, would the 21-member advisory board, will there be representation from all three grand divisions? And we look at where the funding is needed. Will there be any representation from those communities that are impacted?
Chairman Terry, you're recognized.
Thank you. And I'm looking through here to see if that has that specified in there. In subsection E on page 5 of the bill, Speaker of the Senate and the Speaker of the House of Representatives shall strive to ensure the members are appointed to the advisory board shall reflect racial, gender, geographic, urban, rural, and economic diversity of the state.
Thank you, Mr. Chairman.
Thank you. Any other questions of the sponsor on this amendment? Question's been called. Any objections? Seeing none, we will be voting on amendment 4527. All those in favor say aye.
Aye.
Any opposed say nay. Ayes have it. The amendment goes on the bill. Now, the bill as amended, and as a point of clarification, legal has said we need to make clear, do you want to consider amendments 445, 5310, or 4481?
No.
Okay, thank you. So those will not, we've considered and decided not to consider those for the record. Okay, on the bill as amended, any questions of the sponsor? Seeing none, any objection to the question? Seeing none, we will be voting on House Bill 142. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it, and this will be moving on to government operations.
Thank you, Chairman and committee.
All right.
So, did Johnny get rolled to the hill? Okay. Okay. Without objection, I believe House Bill 548 was rolled to the heel. And so without objection, we will pull that up. Chairman Jernigan, you are recognized on House Bill 548.
Thank you.
You have a motion.
Thank you, Chairman. I'm sorry I was presenting another bill in committee. Members of the House Bill 548 replaces one consumer member who's not affiliated with the practice of chiropractic on the board of chiropractic examiners with a member who is a chiropractic x-ray technician or therapist who's been certified in this state for at least 2 years. Consumers will still have representation on the board, and I'll be happy to answer any questions.
Okay. Any questions on House Bill 548? Okay. Seeing none, we are going to vote on House Bill 548. All those in favor say aye.
Aye.
Opposed? Ayes have it. The bill goes on to calendar and rules.
Thank you, Chairman, members.
Okay. We are on item number 10, House Bill 115. Representative Campbell, you are recognized. You have proper motion and a second.
Thank you, Mr. Chairman and members. House Bill 115 changes the allowed weekly attendance time for a child in a Parents' Day Out or similar program operated by a religious institution or organization from not more than 2 days in each calendar week for not more than 6 hours each day to not more than 12 hours within a calendar week. So this gives them more flexibility in making their schedule. Thank you.
Any questions for the sponsor of the bill? Okay, seeing none, we are going to vote on House Bill 115. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and members.
All right, that brings us to House Bill 1344. Representative Ogles, you are recognized. You have a motion and a second.
Thank you, Chairman, members of the committee, and this is my first time before this committee. This is the bill that you see before you is actually the bill. I've got more questions on this than I think anything I've ever introduced. It opens up 24 titles and touches 10 departments within Tennessee. But what this simply does is it instructs TASER to do a comprehensive study on childhood obesity and the economic and socioeconomic impact of the state of Tennessee. And I know the chairman from Cookville has spoken of this several times in finance. This problem we have in this state is probably one of the most unidentified fiscal impacts that impacts our state, as well as the well-being of our children, as well as adults in the state, that we have very little data on, haven't really researched, and they're spending almost no money on in this state to combat. Thank you, committee. I'll take questions.
Okay, any questions on this? Okay, I do have one before we call that. I just, with it opening so many titles, I just want to clarify in committee for the record that assuming that this bill goes to the floor, you're not going to be amending it or taking anything else.
No, committee. There's absolutely no amendments on this. This is the bill as written. This is the only intent I have for this bill, and I am sorry for doing that. What I wanted to do is all those different departments and those different areas of the state to recognize that this subject matter does touch their department, and it's something that we need to take seriously and identify and study. Thank you, Chairman.
Representative Clemens.
Thank you, Mr. Chairman. I just wanted to thank the sponsor for opening up all these titles in the code. Since the last question was probably aimed towards me, I vow not to try to amend this legislation because I do share the sponsor in all seriousness. This is a real issue. This really has been neglected. And so I thank the sponsor for this. And again, I will vow not to amend the bill if that makes you feel better. Thanks.
Right. Thank you. So with no further objections, we're going to vote on House Bill 1344. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman, members of the committee.
All right, that brings us to item number 12, House Bill 1091. Representative Cooper, you're recognized. You have a motion and a second. Oh, it is.
House Bill 1091 removes the provision that prohibited the appointment of an individual to the Board of Dentistry who is regularly employed by or is a member of the governing body of any dental school, college, or dental department of any university or any school of dental hygiene or dental assistant. With that, did I get a motion a second? Thank you.
All right, you've got a motion second. Are there any
This
questions?
bill,
go ahead.
it does just what it says, Mr. Chair and members, and there's no fiscal note, non-significant.
Okay. We have any questions for the sponsor on the bill? Okay. Seeing none, we're going to vote on House Bill 1091. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. You also are with us on House Bill 0789. You're recognized. You have a motion and a second.
Yes, I have an amendment too.
Okay,
Mr. Chair.
there's amendment 004758. You have a motion and a second on the amendment.
Thank you, Mr. Chair and members. Um, E-smoking has become a really, for our children, and with the research that I found, Mr. Chair and members, it's out of control right now, and vaping is being used by underage children has caused the death and mental emergencies that spiked national outrage in the past few years. And whereas more than 44,000 children took part in the 2018 annual survey of drug, alcohol, and cigarette use in 8th, 9th, and 10th grades, about 37% of 12th graders reported vaping in 2018, compared with 28% in 2017. Vaping of each substance that was asked about was increased. This includes nicotine, flavored liquids, marijuana, and hash oil. Vaping is reversing hard-fought declines in the number of adolescents who use nicotine, says Dr. Mitch, who led the study at the University of Michigan. And these results suggest that vaping is leading youth into nicotine use and nicotine addiction, and not away from it. There's a lot of other things that are said. It tells you here that I would have wanted to share with you. I can hardly see this. That Oklahoma has the highest rate of cigarette usage, followed by Louisiana, Nevada, Ohio, Tennessee, and Kentucky. And CDC 2017, and then Washington, D.C. has the lowest rate of e-cigarette usage, followed by South Dakota. I just wanted to share some of those stats with you that I've looked up, and I know that those who are interested will go further and look into what's happening with these e-cigarettes as it affects our children, and especially in these middle grades on through high school. And with that, Mr. Chair, I'll be pleased to answer any questions.
Thank you. Do we have any questions on the amendment? Okay. Seeing none, we're going to vote on amendment 004758. All those in favor say aye. Opposed? Okay, ayes have it. We are back on the bill as amended. Do we have any questions on the bill as amended? Okay. Seeing none, we will be voting on House Bill 0789. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chair and members.
All right, thank you. That brings us to item number 14, House Bill 0455. Representative Thompson, you're recognized. You have a motion and a second. Is the mic on?
Bear with me. Thank you, Mr. Chairman.
Yeah, we got, okay, you're good.
Okay, HB 455 is a bill to include Tennessee in the Psychology Interjurisdictional Compact, or PsyPact as it's commonly known. And the purpose of the bill has several goals and achievements. Some of them are to, one, common understanding of standards in psychology, mechanisms for states to share authority and responsibility to oversee occupational practice, the privilege to practice policies that allow members of the compact states to work in other compact states, improve methods to allow endorsements when members need to transfer a license, primarily based on changing legal residence, and telepractice or telepsychology opportunities across state lines which of course will help the increase public access to these services as well. This was initially brought to us by the Veterans Caucus by the Department of Defense. Licensure issues impact both transitioning military members and their family members. Occupational licensure compacts provide consistent rules that allow licensed members and their spouses to work in other states through the privileged practice policies, or more easily ability to more easily transfer their license to the new state. Tennessee has already entered compacts that affect nurses, EMTs, and physical therapists. 15 states have already joined the compact, including 4 states that border Tennessee. And there are 15 more states that currently have active legislation to join SIPAC. The Tennessee Board of Examiners in Psychology voted to endorse this legislation, and the Senate has already passed this bill with no opposition.
All right. Thank you. Chairman Williams, you recognize?
Yes, I think you stated that 4 states surrounding Tennessee have adopted it, and that 15 states in total have adopted the compact. How many states have to adopt is it 26? How many states have to, and before it comes effect, isn't there a certain number of states that have to adopt before it comes in effect with a compact?
You're recognized.
Excuse me. My understanding is that it takes less than that. I would probably have to ask the representative with the Tennessee psychologist for that exact number. He is here. If either I would ask him, or else you can have him speak to you out of session.
It's the policy not to, if they're not on the list to speak, for them not to speak out of session, but it's 12.
I don't
Chairman
know
Williams,
if
you're
this is
recognized.
out of order, Mr. Chairman, but can I take about 5
Chairman,
seconds to confer?
Thank you.
Chairman-
Yes,
Chairman Williams,
it's
recognized.
absolutely out of order. I may not be the chairman, but it is out of order. I did but though the chairman Leatherwood did show me the data in the description of the bill, and it is arguably either 7 or 12, of which both numbers have been reached. So anyways, when we vote today on this bill, if it passes, then once it becomes law, we would immediately go into the compact. Thank you.
Thank you.
Thank you. Chairman Vaughn, you're recognized.
Thank you, Mr. Chairman and Mr. Bill Sponsor. This sounds kind of cool, but one of the concerns that has been brought to my attention is the fact that now in Tennessee, psychiatrists are the only profession that has prescribing privileges with regards to this area of practice.
Mm-hmm.
Is there anything in this compact that would seek to change the prescribing authority of psychologists within the state of Tennessee?
No, there's not.
All righty. Thank you very much.
Any further questions? Okay. All right. Seeing none, we are going to be voting on House Bill 455. All those in favor say aye. Aye. Opposed? Ayes have it. The bill goes on to government operations.
Thank you, Chair and Committee.
That brings us to item number 15. How is it to the Hill? Okay. Okay. Okay.
I struggle to read. These cheaters are at the point to where if the material's far enough away from, I struggle bringing it back into focus. This is much more convenient. Thank you.
Are we rolling to the Hill? Yeah. Okay. All right. Chairman, is it your intent for us to roll to the Hill for your witnesses to be here, or?
Mr. Chairman, if we get into a situation to where I may ask for that throughout if the questions become so technical in nature.
Okay.
I have the information in front of me, but if we need to,
Okay.
I'll bail out and wait on them. If you would give me that privilege.
Okay. All right. You are recognized on House Bill 226. You have a motion second.
Thank you, sir, and I appreciate the courtesies extended to me. Ladies and gentlemen of the committee, what we have found out through the pandemic, we've learned lots of lessons. We've learned good lessons and bad lessons. We've learned things that we don't need to do again, and we've learned things that need to be fixed. This is an attempt to provide improvement into the supply chain of personnel working within medical laboratories environment. Right now, our medical laboratories are operating under an executive order that allows the laboratories to follow the federal standards, which is CLIA, and an acronym that I will throw around like I can tell you exactly what CLIA stands for. But CLIA is the federal mandates for laboratory personnel. In Tennessee, we have a licensing process for medical personnel right now that frankly is stagnating the ability to hire. During the pandemic, we've been operating under this executive order now for almost a year. I think that we all can say that the way that the laboratories ramped up in production helps stem and turn the tide of the way that we address the pandemic. What this bill contemplates doing is allowing those federal standards to regulate our laboratories, to provide access to more hirees. Right now, we're just frankly not turning out as many candidates for these positions as laboratories require. And we believe that they have earned the right to request this based upon the performance. We've not seen a quality drop. And so that's the request of this bill.
Thank you. We have an amendment on this bill, Amendment 004030. Is that correct?
Yes, sir.
Okay. Okay. We have a motion on that, and that's what you were speaking to that rewrites the bill. Is that correct?
That is correct. And one last point, Mr. Chairman, if I may.
Yes.
The state of Tennessee has already waived these licensing requirements for their public health laboratories. So if it's good enough for state labs, we believe that it also is good enough for private laboratories.
Right. Do we have any questions on the amendment? Okay. Seeing none, we're going to vote on Amendment 004030. All those in favor say aye.
Aye.
Opposed? Ayes have it. Okay, we are back on the bill as amended. Okay. President Clemens, you recognize.
Thanks, Mr. Chairman. And as I told the sponsor before committee, I was hoping that there would be somebody here to answer some of these questions, because I don't want to put him on the spot with some of this. Some of this stuff's way above my pay grade, and I'm sure he can answer it. So, but if we need to wait, I'm happy to do so. Do you want me to just ask the questions and find out?
Please, it's
that. Yes, sir.
Ask the questions. We'll see.
We'll give it a go, and if it usurps my knowledge, I'll be glad to ask to roll this until the experts arrive.
Yeah, no, I appreciate it. So on this bill, like many others, I'm kind of stuck between a rock and a hard place on this, because I've received a lot of communication on both sides, and there is some concern in emails that I've received from constituents about the Tennessee licensure and the CLIA, which this says Clinical Laboratory Improvement Amendments is what that stands for. Personnel requirement are not duplicative, and I don't think you represented that they were. But they say the CLIA personnel standards are less stringent than the licensure requirements and are not adequate to protect the public from substandard practice. Can you just address that generally?
Chairman,
Yes, sir.
Chairman Vaughn.
Yes, sir. Thank you. Representative, Tennessee licensure does not fully duplicate CLIA, and in fact, has become inhibitory in recruiting qualified technologists from outside the state. Tennessee is one of 11 states in the union that has their own state medical laboratory licensure practice. There's individuals of people working, there's examples of people who work in other states with 20 years of experience that are denied licensure in the state as a result due to this regulatory interpretation of the Medical Lab Board. Currently, again, as I stated, the schools within the state are not meeting that. So we believe that the CLIA does provide an adequate level of training and supervisory requirements.
Representative Clemens.
Thank you. I appreciate that. And then I just had two more questions, if you will, Mr. Chairman.
Sure.
And then this letter, I think this is an industry letter we all received. I know it's addressed to the chairman and vice chairman. It argues that this bill would undermine quality laboratory testing in the following ways. It eliminates state requirements to obtain appropriate academic science and clinical training experience, ends the need for testing personnel to pass an examination documenting ability to provide quality testing services, and undermines continuing education requirements that help ensure personnel remain current on emerging technologies protocols necessary to minimize the risk of error. And I think you've touched on most of those generally. And if you'd like to add any further response to any of those arguments that were made.
All right. Chairman Vaughn.
Yes, sir. Well, what this allows people to do is actually get a job within a medical laboratory with a Bachelor of Science degree and then receive the training by supervised and expert personnel that can lead them along this career pathway. Again, it opens it up to fields outside of a very narrow window, which again allows laboratories to be able to choose from a wider array of qualified candidates.
All right. Representative Clemens.
Yeah, thank you. And last question, and I think we all approach these things from this perspective, is the best interest of the patients. And so the other arguments that are made are this will increase testing errors, could result in faulty results or harm to the patient. And none of us want that, obviously. So are you comfortable that your legislation adequately protects patients?
Chairman Vaughn.
Yes, sir. We're asking to implement procedures and policies that frankly have allowed us to deal with this pandemic. And I believe that we have all counted on these people's training, their education, their ability, and I believe that moving forward, this will actually allow us to have better staffed laboratories so that diagnostics are turned around on a faster basis to where we can deal more in real time with problems that we see, not just in the general public health spectrum, but also in private health and individual healthcare.
Thank you very much. I appreciate it.
All right. Thank you. Any further questions on the bill as amended? Leader Marsh.
Thank you, Mr. Chairman. I just wanted to state that somebody came by my office this week and said, in the last year, we have had a lot of these techs have come in and done this hard work since the virus and having to be tested and all. And they said over the last year, the state's only had one complaint about all of this happening. So I think it's already working, and I think it's a good bill. Thank you.
All right. Any further questions? Okay. Seeing none, we are voting on House Bill 226 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. All right, that brings us to item number 16, House Bill 626. Representative Hicks, you are recognized. You have a motion, a second, properly before us.
This is House Bill 626. It's a drug and alcohol rehabilitation bill. And I would like to thank Chairman Hawk for his leadership on this issue last year. He actually passed this bill out of Health Subcommittee prior to us leaving for COVID. And he's kind enough to let me champion this year, so I appreciate that. We all know that the opioid crisis has hit our state very hard, and pregnant women are not immune. Every 15 minutes, a baby is born from opioid withdrawal. And some estimates tell us that close to 5,000 pregnant women will need access to addiction treatment each year in Tennessee. Pregnant women and/or women with small children have many barriers to obtaining treatment, such as lack of treatment facilities, lack of child care, lack of transportation, and lack of funding. House Bill 626 is really about making government work better for our citizens who needs it the most. House Bill 626 requires our departments of mental health and substance abuse, departments of human services, children's services, health department, and the Bureau of TennCare to actively seek and apply for federal, private, or other available funds and actively direct state funds for development of recovery programs. This bill also assures that these entities will coordinate wraparound services for pregnant women and women with small children that are seeking treatment for addiction. So that's the bill, and I'll be happy to entertain any questions.
Okay. Any questions for the bill? On the bill? Okay, seeing none, we are going to vote on House Bill 626. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman. Thank you, Committee.
All right. That brings us to item number 17 on our calendar, House Bill 0559. Speaker Marsh, you're recognized. You have a motion, a second.
Thank you, Mr. Chairman. This bill is somewhat like Chairman Vaughn's bill. The pandemic brought some real challenges along with us, and this bill deals with certified medical assistants, and I do have an amendment.
Okay, well, let's get the amendment there. Both of them rewrite the bill. So which amendment are we?
We need 4973. We don't need
4937?
4937, yes.
Okay. You have a motion on 004937. You have properly before us.
Thank you, Mr. Chairman. The amendment, it only makes a change, and an amendment defines an ambulatory outpatient hospital clinic. And a clinic like that means a clinic or physician's office that is owned and operated by a hospital and that provides treatment to patients who are not admitted as inpatients to the hospital. So that's basically what the amendment does.
Okay. Any questions on the amendment? Okay, seeing none, we are going to be voting on Amendment 004937. All those in favor say aye. Opposed? Okay. Ayes have it. We are back on the bill as amended. Any questions for the sponsor of the bill? Okay. Speaker Marsh, you recognize.
I'd like to say that what we're trying to do here is to allow certified medical assistants who currently, they're legal to practice in a physician's office, but not in a hospital outpatient office. So what we're trying to do is letting these folks that are already legal in doctor's office to practice in hospital outpatient clinics. That's basically what the bill does. I'll answer any questions.
Okay. Any questions on the bill? Okay. Seeing none, we are voting on House Bill 0559. All those in favor say aye.
Aye.
Opposed? Ayes have it. The bill goes on to government operations. That brings us to item number 18. Chairman Kumar, you recognize. You have a motion, a second.
Thank you, Mr. Chairman. House Bill 828 is based on recommendations of the Alzheimer's Advisory Council. It was my honor to serve on it along with Senator Crow over the last 2 years. Alzheimer's is a disabling condition that affects great minds, but also has a great impact on the families. Consequently, about 5 million Americans suffer from it, impacting more than 15 million family members. In Tennessee, it's as much as 75,000 citizens. And by 2030, 1 in 5 Tennesseans will be over the age of 65 and vulnerable. The House Bill 828 asks for the Department of Health, along with the Tennessee Commission on Aging and Disabilities, assisted by volunteers from the Alzheimer's Association, to develop educational materials about risk reduction, early detection, diagnosis, and treatment of various dementias. And they will use existing sources and as well as resources put out by the CDC, including Dementia Roadmap and healthy brain initiatives to create dementia-friendly communities. I think it's a much-needed effort and a great deal of burden carried very ably by the Tennessee Commission on Aging and Disability and the Alzheimer's Council. I'll be happy to answer any questions.
Any questions on the bill? Okay, seeing none, we're going to vote on House Bill 0828. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you.
Okay, with that, it brings us up to item number 19, House Bill 877. I'm going to have to pass the gavel to Vice Chair Leatherwood.
Chairman Terry, you're recognized on House Bill 877. Do I have a motion and a second?
Second.
Boy, we almost killed it quick.
Oh, man,
for you.
that was quick. That'd been bad. Thank you, committee and chairman. This bill is from the Board of Pharmacy, and it passed the Senate last year, and it was through the House Mental Health and Substance Abuse Committee last year. And once COVID hit, it did not go any further. Simply, the bill will enhance patient safety by ensuring the U.S. pharmacopoeia compounding standards are met and deletes a redundant reporting requirement.
Any questions of the sponsor? Seeing none, any objection to the question? Seeing none, we will be voting on House Bill 877. All those in favor say aye.
Aye.
All those opposed, nay. All right, the ayes have it, and this will be moving on to calendar and rules.
Chairman Vaughn.
Thank you for the point of personal privilege. Mr. Chairman, I'm very thrilled to announce today that four-time Pro Bowler and one-time All-Pro long snapper, the pride of District 95, native of 95, resident of 95, Morgan Cox has just signed a free agent contract with the Tennessee Titans to shore up that position.
All right.
So District 95 will be glad to aid our Titans in one of their weaker spots. So just wanted to share that with everybody. I'm bursting with pride.
I hope you do well.
All right, thank you. And now, thank you. We have no further business before us, but I do want to say something here. And we're in the throes of session right now with committees that are just getting backed up, and we had a lot of work on our calendar today, and I just would like to thank the committee for the hard work, and we're getting out here with a robust calendar and with 20 minutes to spare, so thank you for your work. With that, with no further business, we are adjourned.
That's right. That's right. With you covering the